Welcome, everyone, to this exciting series from Maternal Health Awareness Week, organized by the Greater Newark Healthcare Coalition's Women's Reproductive Health Clinical Advisory Group. My name is Evie Gonzalez, and I am the Program Manager for the Emotional Wellbeing Program at the Partnership for Maternal and Child Health of Northern New Jersey. And I will be moderating this panel that's going to talk about ways to improve communication between mom and partner or co-parent during pregnancy and postpartum. So I would just like my esteemed panelists to take a few minutes to introduce themselves and their titles. So Lorraine, would you mind going first?
Sure, Evie, thanks for having me. Hi, everyone. My name is Lorraine, and I'm a perinatal mental health coordinator here at the partnership, and I'm with the Emotional Wellbeing Program.
Thank you. Kevin?
Hi, I'm Kevin. I'm the program manager for the Fellows Fatherhood Program.
Awesome. And John?
Thank you. Good afternoon. My name is John Bermudez. I'm the Fellows Fatherhood Program Supervisor.
Great. So we'll just go and jump right into the conversation. So before we can actually talk about ways that fathers and partners and co-parents can support their their birthing patient, I think it's important to talk about mental health in general. So Lorraine, I'm going to gear this question towards you. What would you say are some of the common signs and symptoms of postpartum depression that partners and co-parents and dads can be on the lookout for?
That's a great question, Evie. Postpartum depression looks different in everyone. Let's acknowledge that, right? However, they share some similar symptoms like intense sadness, anxiety, tiredness that lasts long after birth, if untreated. Postpartum depression can onset anytime after childbirth, and it often starts within 1 to 3 weeks after having baby. Shame might be present, guilt might be present, and trouble bonding with baby or concentration. In worst cases, suicidal ideation may also be present. And when it comes to postpartum anxiety, it looks different, and it presents itself with like racing thoughts, constant worry, the feeling that something terrible will happen. You may experience sleep or appetite disturbance, and sometimes you may even experience somatic symptoms like dizziness, nausea, irritable bowel movements, and headache. And most reported symptoms of postpartum anxiety is heart palpitation and chest pain. So I first would like to say, if you find yourself in this space, please know that there's a lot of resources out there. You are not alone. There are treatments. Don't be afraid to speak up.
Absolutely. And we know that 80% of new moms do experience a lot of sadness or anxiety right after they have the baby for the first 2 weeks. But when does it stop being baby blues and turn into a possibility of a perinatal mood and anxiety disorder?
So since I've just highlighted postpartum depression and postpartum anxiety, oftentimes postpartum depression is in the forefront of many parents, right? So they assume that when they're experiencing baby blues, immediately they are having postpartum depression, and that's not the case, right? Baby blues is a common yet temporary experience that mimics the symptoms of postpartum depression. But I won't say the beauty because it's equally challenging, right? But, baby blues tends to go away on its own after birth, right? But if the symptoms last more than 2 weeks, and you are still experiencing the sadness, the trouble sleeping, a lot of crying, it's time for you to inform your care team about your symptoms. Don't just assume, yeah, it's just the baby blues, and you are going a month and 2 months into, feeling horrible or not feeling like yourself.
And definitely part of your care team could be your co-parent, it could be the father of the baby, your partner. So that's why it's so important to have these discussions and integrate them into, your care and how you're feeling emotionally in these transitions. So what I want to do is let's talk a little bit about pregnancy, because I do believe that with pregnancy, there is some preparation that could be done between mom and her partner, and to make the transition a little bit more smoother, because one of the things that we always hear is people are unaware of how much it impacts the dynamic between them and their partner once the baby arrives. So this is a question I'm going to throw out to everybody. What do you think during pregnancy are some important things to discuss to ensure that both sets of parents are on the same page? So anyone feel free to unmute yourself.
I remember discussing just how to not take things personally. We're both stressed, we're both juggling. And ultimately, we will find the time to check in. At times, it may be in the moment. At times, it'll be establishing a quiet, safe space in the evening. But the key is to not shut down and stay communicative.
Mm-hmm. And do you feel that it's very easy to do that? And when transitioning into this role, to kind of shut down and not engage with your partner about how you're feeling?
It's extraordinarily hard. And difficult, no question. But in establishing the safe space, you push yourself into new places where you can just be better for your collective, be better for your newborn, be better for your significant other, and just fight to communicate and stay active and stay engaged.
Absolutely. Thank you, John. Anyone else?
I definitely agree with John in terms of communication. I think especially during those highly stressful times, just at least on a basic level, making sure that you guys are on the same page. You may not always understand each other's feelings or how those feelings are being expressed, but again, keeping an open line of communication just to try to touch base and at least make sure that you're aware of how the other person is dealing with something and how you can assist it.
Wonderful. Yeah, communication is definitely key. And what about you, Lorraine?
I feel like during pregnancy, it is essential for all parties involved to discuss their expectations, right? Expectations like who is better at taking care of the late night feedings, right? Returning to work, what will that look like? Childcare, how soon are we comfortable with sending baby to daycare? Who should do drop-off or pickups? Whose job is more flexible and can afford to take off when the baby gets sick? These are all essential areas to explore before the baby comes. I will also advise new parents to jot down at least 6 people they would like to have as part of the support team. Each person should come up with 3 people they will most likely call on when needing uninterrupted sleep or date night. That's just my opinion.
No, I think that's a great idea. I think that's a great idea. I mean, we all know that it takes a village to raise a child. And I think it's important to set up, during your pregnancy, those people that you do want to help you with whatever it is you need help with, whether it's laundry, whether it's to watch the baby so you get a date night, or to get some sleep. So I do agree with that full-heartedly.
And Evie, also, I think it's crucial to understand what support mean in your relationship, right?
I agree. Oh, yeah.
How I like to be supported may differ from my parenting partner interpretation of support. Therefore, if you desire to be emotionally supported, tell your partner what that looks like. Emotional support may mean asking about my day, even though I was home with the baby all day.
Yeah.
Talk to me. If I like tangible support, tell your partner what that looks like as well. Tangible support may be taking the baby from me so I can get a nap, right? Washing the bottles without me asking, doing the nighttime routine, communicate. I say all this to say, don't assume anything, communicate about everything. That's the key.
That is such a key, because so many times we think our partner can read our mind and they should know that they should be doing X, Y, and Z, when in reality they don't. They're juggling. Usually they're back at work a lot faster. They're juggling work. They're dealing with this transition of having a baby as well. They're probably not sleeping as well. So it's important for you, if this is something you feel strongly about that you want them to do, to be able to communicate that with them. I agree 110%. So as far as help goes, there's always that, sometimes couples and co-parents and parenting partners differ on who they want to have come and help them, and I think it's important to make sure that you are communicating boundaries with each other, that you both are on the same page about when it comes to help, when it comes to family, friends, visitors. So what are some tips that each of you would give to make sure that you're able to communicate those boundaries and to make sure that you're on the same page when it comes to friends and family? Lorraine, do you want to start? Like, what are some of the things that you hear in your group?
When it comes to setting boundaries, let's be honest, people will make you feel guilty about it. All right.
That parent guilt is real.
But you must first identify the boundaries you would like to set. Don't just go and not know and just trying to figure out what you want to tell people, but figure it out, identify it, and communicate it with confidence so they know you are clear about those boundaries. Those who value you in reality will respect those limitations, and people will have issue with it, right? But don't let it affect you. Stand firm in your decision. And that's my advice, really.
That's great advice. Thank you. Kevin?
I definitely think that's a good time to kind of establish what those boundaries are with the parent, the other parent, and utilizing teamwork. If you guys both know that we're on the same page in terms of certain boundaries, we can bounce off of each other and communicating it to others. So if my partner may feel a little bit insecure expressing it to a certain person that I may not have an issue with, I can take the lead on that. And vice versa. If there's somebody I'm uncomfortable having that conversation with because we're on the same page, maybe she can take the lead on that. But utilizing teamwork once you guys understand what those boundaries are together.
Absolutely, because that's what you are. You are, once you are a team and you need to work together. And, sometimes there's a lot of difficult conversations that need to be had with each other's family. So I like what you said, like having that person whose family it is sort of take the lead to initiate that. Yeah. And John.
Thank you. Well, I give my wife a lot of credit. While she was pregnant with our children, she used to talk about trying to create a cocoon for herself and a nest. And I believe she used those words intentionally, just to paint a picture of a safe space that obviously cannot include everyone. So
I love that. I love it.
So I think it helped people ultimately understand that some will be involved, you are all appreciated, and we will let you know what your role is and how you can help.
Awesome. I love it. And I love what you said. you know, we're going to let you know what your role is and what you can help. Because one of the things that, you know, we've encountered is that sometimes our moms are being offered help that they don't necessarily need, but they need help with something else, and they don't feel comfortable communicating that. So, you know, it's important that you do that, you know, as friends and family that are going to be helping. It's important that they're giving you the type of help that you need, because that's what they want for you. So I love that you kind of took that power and said, no, we're going to tell you what we need help with. And I love the whole cocoon thing. Okay, so Lorraine, this question is for you. So we know that parenting is on a whole new level now with social media. Okay, there's so many different pages out there. There's so many different, you know, you're following people that you haven't followed in years, and they're having babies around the same time as mom. So it's very easy to get caught up in the comparing of yourself, of your family, of your partner when it comes to social media. How do you prevent moms from doing that?
Oh, that's a good question. You know that famous saying that comparison is the thief of joy, you know.
Ooh, there she goes with her poetic stuff.
When you when you do that, you are jeopardizing your own happiness by comparing yourself to other parents on social media. Like, parenthood journey looks different and feels different for everyone. Like, your journey may not be the snapback story, and that's okay, right? Your parenting partner may not be the super parent, or may ask 100 questions daily. That's okay too. Like, just understand that your unique experience of motherhood is not diluted by, you know, other people's experience, right? Keeping social media is a filtered reality. They may not post their baby throw up. They may not post when they are looking like a hot mess. Right? They may not post that reality. Everybody posts their highlights and rarely posts their lowlights. So parenthood is already challenging, both emotionally and physically. Try your best not to add social media to the mix. Get off social media if it helps, and trust the process. You are doing the best you can. Trust me, you are. So your best is good enough.
Absolutely. I love it. I love what you said. You know, everybody, you know, on social media, you're going to put that perfect picture that's probably been filtered with 1,000 apps, and you're not getting an accurate depiction of what exactly is going on in the home. But it's so easy for us to be caught up on that. So and another thing, if you are like me, where it's hard to stay away from social media, then maybe limiting the amount of time that you are going on it. You know, don't go on it 24 hours a day. Maybe say 2 or 3 times a day, and I'm going to go on for 15 minutes and that's it. You know, but thank you for that. This question.
It's easy to get caught up.
Oh, it's so easy.
Yeah,
Are you
it's
kidding?
easy to
I get
get caught up.
sometimes, listen, full transparency. I could be on social media and find I'm on like someone whose cousin was related to this one and that one. And I'm like, how did I get here? You know, and a lot of people do that when they have that downtime. So yeah, I agree with that. Okay, this next question is for Kevin and John. And I really am interested in this because you know, I'm going to be the partner, you know, with my wife. I'm not going to be the one who's carrying the baby. So I'm looking to this question for you guys to give me advice for the future when that time comes. So as a co-parent dad or partner, what do you think are some things that are done that help you remain engaged with the baby that I can learn from you guys?
Oh, I think being engaged with a lot of the tangible things early on helps. So the amount of time spent, you know, being there as much to change the diapers, the feedings, I think that initially builds the the relationship, or at least gives you a starting point if you're uncertain where to begin.
I think that's great. So it's almost like making sure that the partner is roped in right from when the baby comes home from the hospital.
Exactly.
Okay, that's great. What about you, John?
I think for me, it's about not underestimating the role my smell, my touch, my voice plays in our child's life, and really knowing that the importance of that. I think on another level, I want to play that jack of all trades, do everything I can behind the scenes role. But I think
Yeah.
to Lorraine's point earlier around, I also will feel most validated with a very specific role. It could be the laundry. It could be
Mhm.
that night feeding. It could be when the daycare time hits, that's my responsibility. But having a defined role is important to my confidence as well.
Okay. Love that. And then what are some things that your partner says that are helpful to you? And this is for Kevin and John.
I mean, I think, the obvious compliments or gratitude is always, helpful. Definitely, boosts confidence, and especially as an unsure parent, lets you know that you're doing on the right track or you're doing the right thing. So
Yeah,
I think, anything in terms of positive affirmations definitely help.
wonderful. Thank you. John?
No, I 100% agree. Just to feel validated, just when you can, the thank yous and the appreciation for what it is I'm trying to do and the role I'm trying to play. And yeah, I think it's very important.
Okay, great. Thank you so much. This was beneficial for me as the partner. Okay, so one last question. As we can see, the big theme that's been coming up in our discussion has been communication, 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 communication. So this is a question that I have for all of you. What are some tips to improve communication, especially when it comes to ensuring that both parents are doing okay emotionally and mentally? Because we know that there are fathers that do have a difficult time transitioning into this role and are dealing with, their own mental health issues. So what are some tips that can be done to sort of like check in on both parents and make sure they're doing okay emotionally and mentally? Whoever would like to start.
Well, I think in addition to creating the opportunity and the space to have fluent conversations, in addition to that, I think it's also important to make sure that you're listening a lot more than you're talking. I always believe when it comes to communication, listening is more essential during the critical times. Make sure that you understand exactly what the other person's saying or communicating to you. And then I think it makes it a little bit easier to go from there.
Mm-hmm. Love that, which for me sometimes is hard, but that's a lot of people. Okay, John.
Yeah, I think for me, we have to figure out how to allow for sleep. Sleep allows us to function, and when I can function, I can use my words appropriately and communicate. So it all sort of connects. I also think we have to forgive. Pressure gets ratcheted up with a baby, and as we discussed earlier, family and finances and more stress, and things are said sometimes in things are not always phrased the best way with the tension. And I think that we have to not own that and try not to take it personally. And continue the process of checking in, as I now say to my kids, use your words. We have to use our words as best we can. And it's a process and it's difficult, but we strive to do.
All right, great. And Lorraine.
my takeaway from the guys is to use your word.
Which sometimes we don't do that. Like, you know, as women, we don't, and we fly off the handle.
Yes, we don't use.
So this is good for us. This has been beneficial for us.
So that's my takeaway. I will apply that. Okay. But you know, the Postpartum Stress Center has a postpartum pack that I think is amazing, and every parenting partner should review when they get the chance. Is on their website. It discusses like things to look for, listen to, and things to do and not do, right? Because we all know that communication is vital to any relationship. Like I've mentioned earlier, don't assume anything, communicate about everything. Just because the person looked visibly okay does not mean that they are well mentally. Depression doesn't have a look, so it's important to check in with each other, ask the hard question, you know, offer help even if they have it all figured out, and ask for help even if you think you can do it all. Extend grace toward each other under the notion that parenting is an experiment of trial and error, and you got this. That's all. You got this. But communicate it.
Absolutely. I love what you said about the grace, because that's one of the things that I think is so important. If you think about it, when we get a new job, we give ourselves grace at the beginning to learn the position, and we're not so hard on ourselves. And, you know, and this is what transitioning to a parenthood and into parenthood is. It's a new transition for you when you have to be able, you know, to give yourself grace and understand that you're not going to learn everything right out of the hospital, and be there for each other and understand that this is a learning process. And I think that's so important.
Yeah, and in addition, every parent have their own way. They have their own way of doing things, right? And that's okay too. They don't have to do it my way, right?
Yeah.
So extending grace and understanding that their way is okay too is also important.
Relinquishing that control is very important. Absolutely.
I agree.
All right. Well, this has been a great discussion. I thank you so much for joining me. Thank you, Lorraine, Kevin, and John. This was great and very enlightening. I know I learned something, so I hope all of you out there did as well. So tune in tomorrow at noon, where we will continue with our Facebook Live discussion, and we will be talking about grief and loss. So thank you, everyone, and have a great afternoon.
Use your words.
Thank you.
Bye.
Yes.
Especially men, use your words.